Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is mediastinal syndrome. In the previous videos we have already covered about the superior mediastinum and the inferior mediastinum, and in this video we will try to cover the mediastinal syndrome. So what we know till now about the mediastinum? Mediastinum has mainly two parts. One is, so let's say this one is the mediastinum, this one is the superior mediastinum, this one is the inferior mediastinum. And in case of inferior mediastinum, there is the anterior, then is the posterior, and the middle mediastinum. So these are the whole parts of the mediastinum. Now we will come to a disease or a disorder, that is the mediastinal syndrome. So what is it? It is the compression of any mediastinal structures by any tumor or any other structures is known as, or a group of symptoms is created, it is known as the mediastinal syndrome. Now what happens? Mediastinal syndrome is a collection of group of symptoms, so there must be some symptoms which present in case of this. So what are those symptoms? Number one, that is the obstruction of the superior vena cava. In case of superior vena cava, which collects the all the deoxygenated blood from the upper part of the body, rise to the engorgement of the veins in the upper half of the body. So if the venous drainage have any issue, then it can seriously create any problem or any issue. Then number two, that is the pressure over the trachea, which causes the dysphonia and cough. If there is any pressure created above the trachea, there will be some issue. That issue is known as the dysphonia, and this dysphonia, and with that there is also presence of cough. Number three, that is the pressure on the esophagus, which causes the dysphagia. If esophagus has any problem or any issue, that issue will be the dysphagia. Then number four, that is the pressure or the left recurrent laryngeal nerve gives rise to the hoarseness of the voice, that is the dysphonia. And number five, that is the pressure on the phrenic nerve, which causes the paralysis of the diaphragm on that side, because all of us are known that phrenic nerve supplies the diaphragm. So if the phrenic nerve have any issue in that part, that side or that part will be affected. Then the pressure on the intercostal nerves gives rise to the pain in that area supplied by that nerve, and it is called the intercostal neuralgia. Then the pressure on the vertebral column may cause erosion of the vertebral bodies, and the common cause of the mediastinal syndrome are bronchogenic carcinoma, the Hawking's disease causing the enlargement of the mediastinal lymph nodes and aneurysm or dilation of the aorta, etc. These are the some common problems of mediastinal syndrome. So what happens? The first one is the obstruction of the superior vena cava, which gives rise to the engorgement of the veins in the upper half of the body. Number two is the pressure over the trachea, which causes the dysphonia and the cough. Then number three, that is the pressure on the esophagus, which causes the dysphagia. And number five, that is the pressure on the left recurrent laryngeal nerve, which gives rise to the hoarseness of the voice, which is dysphonia. Then the pressure on the phrenic nerve, which causes the paralysis of the diaphragm of that side. And the pressure on the intercostal nerves gives rise to the pain in that area which is supplied by them, and it is called the intercostal neuralgia. Then the pressure on the vertebral column may cause the erosion of the vertebral bodies, and the common cause of the mediastinal syndrome are bronchogenic carcinoma and the Hawking disease, causing the enlargement of the mediastinal lymph nodes and aneurysm or dilation of the aorta, etc. So if you have any question, you can ask in the comment section. Hello, do you have any questions related to mediastinal syndrome? Okay, you have no questions. So thank you so much for watching the entire video. Do like, share and subscribe to my channel, and thank you so much for watching the entire video.